Hi everyone! Our webinar today is titled 3 Tips to Managing Defiance and Noncompliance. Defiance and noncompliance is a pretty prevalent concern when I speak with parents and teachers at school, and as you might know, this can look very different in each case and each situation. Because I wanted to target as many parents and as many situations as possible, I put together some tips and strategies that can be applied to a general audience. So we hope that you leave today with a few tips and ideas that can be used in your home. Today's webinar, along with many others, are tailored for parents with special needs children from very early learners to teens and young adults. So please feel free to check them out on our website. This webinar is being presented by our VillageED program. We are a team of professionals including speech pathologists, BCBA, nurses, program specialists, and much more. And we're all for special education. We work together to provide that tailored support that families need. So if you're interested in support with one-to-one consultations, school IEPs, a resource library, please stay with us until the end of this webinar where I'll briefly introduce ourselves a bit more. And to introduce myself, my name is Stephanie Lee and I am a BCBA. I've been working in the field primarily with children and teens with autism and ADHD under the practice of ABA. So a lot of my content is derived from this practice. Getting into our topic today, we will be covering the what and why of defiance and noncompliance. We'll also cover 3 tips to behavior management and effective strategies to parenting a defiant child or teen. So let's talk about the what. So noncompliance and defiance. Kalb and Lober define noncompliance as doing anything other than what has been requested by a parent or other adult authority figure within a specific time frame. And to an extent, I do believe that some noncompliance is definitely age appropriate, and it's a very common concern for many families. However, if we start seeing a long-term pattern of this, it may bring some negative consequences, such as negative impact on social and academic development. So, for example, cooperation and following instructions are such critical skills, especially during the early stages of learning and development at home and for school. But with defiance, some of these skills may not be mastered and they actually may be hindered. So, also having recurring issues with defiance definitely impacts relationships with others, whether it's with authority figures like parents or teachers or staff members, also with peers as well. So it's very important that we are mindful of effective strategies to support these non-compliant behaviors from very early stages. And diving a bit deeper into the what, let's discuss what non-compliance might look like. So, what does noncompliance look like? Walker and colleagues analyzed noncompliance into 4 different forms. We have passive noncompliance, which is not responding to instructions, but not angry nor hostile. So, for example, a parent might be calling a child for dinner, but the child does not respond and continues to play, just simply ignoring. Second, we have simple refusal, which is a bit similar to direct defiance, but it lacks that aggression component. So it involves acknowledging the instructions but communicating refusal. So, for example, a parent asks a child to wash hands, and the child responds, I don't have to. I just washed my hands a few minutes ago. So, here, this child is not carrying out the instructions, but there's no aggression, and he or she is calm and is just open communication of the refusal. Third, we have direct defiance, which is engaging in escalation, showing verbal aggression and or physical aggression. Usually when we do hear about noncompliance and defiance, this is the type of noncompliance and defiance that we're most concerned about. A child might show anger along with the refusal. An example for this might be when a parent asks their child to clean the room and the child yells or screams in response and maybe even demonstrates some physical aggression as well. And lastly, we have negotiation. The child is bargaining, reasoning, negotiating with adults when they don't want to follow the rules. And we see this quite often at school with students and teachers, where the child is kind of negotiating the workload. So a parent or a teacher might ask a child to complete 5 pages, for example, of worksheets, and the child negotiates and asks, can I only do 3? Can I start tomorrow? Can I start later? Or another example is when a parent asks a child to turn off TV and the child responds 3 more minutes or 5 more minutes or after this show and so on. So you might be asking yourself, why is my child engaging in noncompliance and defiance? So there are many factors that may contribute to why they're engaging in defiance, but some of the ones may be listed below. It might be even one or more of the following. So first, maybe the child is just asserting independence. It may be a learning a sense of autonomy, and this may be demonstrated in any shape or forms of all different ages. And to an extent, this is completely age appropriate. However, like I mentioned earlier, an ongoing and a long term pattern may be a bit concerning. So, usually, noncompliance starts during childhood, peaks in the teen years, and it diminishes as they mature into adulthood. But if it's not the case, that's when we do want to work on those non-compliant behaviors. And that's why it's so important that we target it during earlier stages. Second, we have lack of comprehension. Maybe the child or teen simply does not understand what is being expected. And for this, just take time to help your child understand by modeling or setting expectations and guide the child to carry out the expected behaviors. Third, we have lack of motivation and learning history. The child may not be motivated to cooperate or may have learned to get away from following instructions in the past. So, lack of motivation, maybe the parent can establish some kind of reward system, or when the child does comply to instructions, maybe in the past there really wasn't any reward or any praise for that. So, over the years, the child learned that there's really no motivation for it. Or maybe even it's a learning history of escape. So the child learned to escape from following directions in the past, and now this child has a very lengthy learning history. That kind of ties in with our next one, escape, where it's just simply wanting to escape or terminate or avoid a task or activity. And lastly, attention. And I want to talk a little bit about attention. This is when a child or teen might be engaging in noncompliance to access attention, and it might even be for negative attention. When you notice these patterns of seeking for attention, what I would typically do is to set aside more time to spend quality time together. Provide praise and attention, whenever you notice any good behaviors, and hopefully this will not only keep them full, as in not hungry for attention, but it will also teach them appropriate ways to gain attention. And next, I just wanted to share a quote that I really enjoy, and this is what I think about quite often when I work with parents and teachers. When a flower doesn't bloom, you fix the environment in which it grows, not the flower. And I strongly believe that any parent looking for recommendations to change their child's behaviors are most likely willing to change their own behaviors and the environment to apply that strategies as well. So let's start talking about those strategies that parents and caregivers can take. So I want to begin here about the four different parenting styles. We have authoritarian, authoritative, permissive, and uninvolved. Parenting comes down to two factors, right? We have parental support and parental limit, where parental support ties in with how responsive that parent is with their child, and parental limit is more about that level of discipline and control. So the first one in yellow, we have an authoritarian parent, and the picture kind of shows it all. This is a parent who has low responsiveness and high control. There is a focus on obedience and punishment over discipline. This is a parent who is centered around rules and regulation, but lacks that emotional support or reasoning. Second, we have authoritative parent, and that's the one in the blue here. This is a parent that has high responsiveness and high control. And this is a parent that listens to the child, supports the child, shows a good balance between the two factors, validates the child's emotions, all while establishing clear rules. So, for example, instead of saying, go to sleep because I said so, an authoritative parent might say, go to sleep so you can let your body rest and refresh for tomorrow. So this parent creates a positive relationship with their child, but they also have enforced disciplines and rules. And this is kind of where we want to be and where we aim to be. Third, we have permissive parent in pink, and we see that picture. This is a parent who has high responsiveness and low control. So there's no rules, no discipline, but there may be a strong emotional support coming from the parent. This is a parent who might say things like, kids will be kids. Lastly, in purple, we have uninvolved parent. This is a parent that we are concerned with. We want to provide as much support as possible. This is a parent who has low responsiveness and low control, provides very little guidance, nurturing, or any attention. We might even say that this is a bit of neglect for this type of household. So, how to promote cooperation? Tip number one, let's talk about proactive strategies. These proactive or antecedent strategies, and we can use them interchangeably, are kind of like our first line of defense. And these might include gaining attention before providing clear and appropriate instructions, being mindful of tone and volume, and presenting alpha instructions. So, let's pause here and talk a little bit about alpha instructions. These are the kind of instructions that are more likely to be effective commands. This is where we make eye contact before delivering the instructions, and the instruction itself might be specific, simple one step instructions instead of what we call beta instructions. And these beta instructions might be something like, will you come here? Let's clean your room. Or those questions with the can you? We actually want to be very direct. And aside from these alpha instructions and moving on with our other proactive strategies, we also have building momentum and providing choices because we want to promote shared control. Tip number two, we want to use reactive strategies or otherwise known as consequence based strategies. So I highly recommend that we stay calm and neutral. Teach appropriate ways to communicate that escape or termination of demands, whether it's I don't want to do it or all done, I need a break. Teaching these appropriate ways of communication might help with those children who engage in aggression, whether it's verbal or physical, or who just kind of runs away or leaves the area without notifying the authority figure. So we can teach these appropriate functional communication responses to replace those behaviors. Third, we can also minimize the task or make the task easier. We can also use guided compliance by guiding the child to carry out the tasks. We can also use differential reinforcement of compliance, which is just a fancy ABA term for providing that positive reinforcement, whether it's praise, physical attention, or rewards for any type of compliance. And lastly, we can also give additional time. But we, of course, we want to make sure that we are following through. And our last tip number three is to utilize these general strategies of parenting, especially with a defiant teen. So, first, we have allowing shared control, which I highly recommend. So, our parents should be making it clear that you want your child and teen to feel respected and understood. So, make those rules and regulations for your home together with your child. You can even brainstorm together and you can ask what they value and how they want to be treated. Ask for their opinions and get their input as well. So, another great way of promoting shared control is to consistently provide choices. Second, we have modeling expectations. Serve as a role model for that behavior that you're expecting from your child. During tough situations, we want to remain calm and patient. For example, when your child is escalated or being defiant, we want to refrain from reciprocating that anger. We want to stay calm by giving them, or maybe even yourself, some time to recollect yourself or calm down. And when you do enforce consequences, we want to do it in a very reasonable manner. Third, we want to set clear boundaries. So we want to be clear about what you will and will not tolerate. And this goes hand in hand with modeling expectations. For example, let them know that it's okay to be angry, but that it's not okay to use profanity. Fourth, we have bonding. I know it might sound a bit silly to build rapport with your child, but it's so important. It takes extra effort from both sides, especially when we want to control that defiance and noncompliance. But taking time to connect might even help us understand maybe that there is additional external factors that are contributing to that defiance. So maybe we might get to understand our child or teen better. And lastly, don't be afraid to seek professional assistance if it's necessary. Having that third person to observe and provide guidance might be tremendously helpful. So, how do you seek additional help? We can always reach out to a psychologist or a psychiatrist. We can also reach out to ABA services who can help with behavior management and caregiver training. Or you can even reach out to us for our Village program. So, speaking of the Village program, we have many benefits that you can check out on our website. We have guidance with IEPs, we have a private community, a resource library that I will share, and last but not least, we have on demand support from educational specialists. So, you can speak with a BCBA, a speech pathologist, or maybe even a special education specialist who can give you that support. So I just wanted to share this really quickly. On our Village website, you can see this webinar along with many other webinars. So if you are curious about what other topics there are, please feel free to check our website. And along with those webinars, we have these free parent resources, which are kind of like different pamphlets that have a lot of information that are relevant to those webinars. So those pamphlets that I just shared, they're included in this resource library as well. And in this resource library, we have three different categories. We have parent resources, where we have all sorts of different informative um, just pamphlets, including various topics. We also have behavior management and skill acquisition procedures, which is kind of like a lesson plan that parents can use to teach different skills. And we have printable activities that you can just print and share with your children. And we have these worksheets for all different ages, up to teens as well. So if you're ever interested and if you want to check us out, please feel free to check our website at xcomweb.com/social emotional or villaged.com. You can also email us at simplesped@xcomweb.com. Our phone number is 844-387-5836. Our office hours are Monday through Friday, 8 to 5:30 p.m. If you have any direct questions for me, my contact information is below, so please do not hesitate to reach out. And thank you. Thank you for your time to watch our webinar today. We hope you have a great rest of your day. Again, if you are a parent who needs some extra support, please feel free to reach out to us and see how we can help. Thank you.